Okay, our next guest is a cardiologist, public health expert, and dean of the Friedman School of Nutrition Science and Policy at Tufts University. Please welcome Dr. Dariush Mozaffarian. Doctor, I'm so anxious to talk to you because you are the dean of the only independent school of nutrition in this country. And I've been trying to tell my audience ever since I've been on the air, you are what you eat. Food is either medicine or poison. And I feel like it's been falling on deaf ears, but there's one guy in one school who believes me, and he's got a lot of degrees. He went to Harvard and a lot of good places. So why don't you tell us, I know you've said that 12% of Americans, only 12% are metabolically healthy. What does that mean, and why are we not healthy metabolically?
Yeah, among adults, only 12% meet sort of basic criteria for being healthy, having a healthy waist circumference, having normal levels of blood cholesterol, blood glucose, and not having hypertension. Just those few minimum criteria, and 88% of adults are not metabolically healthy. So many more of us are sick than are actually well.
And I'm surprised to find that an alarming number of Americans I talk to still are not aware of the connection between having a bad result with coronavirus, if you get it, and obesity. But that is, outside of being very old, that is the main factor, is it not?
Well, what we're seeing with COVID-19, with coronavirus, is really a fast pandemic on top of a slow pandemic. Coronavirus has hit the world in a matter of months. It's been devastating. And yet, at the same time, obesity and diabetes have hit the world over just 30 to 40 years. 30 to 40 years ago, the world did not look like this. And we have had skyrocketing rates of obesity and diabetes, never before seen in human history. And that slow pandemic has been at least as equally devastating and really in almost every other way, much more devastating than coronavirus. And yet, because it's happened over 30 or 40 years, the world has been really collectively shrugging and not really doing what it takes or taking it seriously. And what's really striking now, Bill, is that there's a clear link between those two things. If people don't have high blood pressure, chronic kidney disease, diabetes, obesity, heart disease, a couple of other risk factors, many of which are diet related, they don't get that sick from coronavirus. And so it's very possible, if we had a metabolically healthy population, if our country looked like what it looked like 40 or 50 years ago, coronavirus would have been deadly, but it would have been far, far less problematic. We wouldn't have had to shut down our economies, spend trillions of dollars in bailout dollars. And so this fast pandemic of coronavirus has hit on top of this slow pandemic, and we have to address obesity, diabetes, and other diet-related illnesses because, first, just to deal with coronavirus right now, but this is not going to be the last pandemic. This is not going to be the last one, and we really need a resilient population. So this has to be a national priority.
All the more reason why I thought it was a scandal that nobody I saw in those press briefings with Trump, the Surgeon General, Dr. Birx, Dr. Fauci, none of them ever talking about what you can do to get yourself healthier. Just about putting a mask on your face and avoiding and hiding. I never heard them suggest anything about eating. And we know now that you can't hide from it and you can't shut down the economy indefinitely. The one thing we could have done was to make ourselves healthier, and we have had the time. I've heard you say, or read you say, that it takes only 4 to 6 weeks to change your metabolic profile. We were locked in for that time. They could have said, look, you're staying home, you're getting your staycation, the government is footing the bill, we've spent all this money to hand out to you. Here's what you can do in return. You could get yourself healthier. Tell me why you think the medical establishment doesn't talk to the American public that way.
Well, first, it's not too late. So let's start here with this show. But I think that, we didn't understand, the scientific community didn't understand COVID-19 very well. And really, it's been now a couple of months that we've seen these incredible reports in the United States, in the United Kingdom, in Italy, in China, every nation that's looked, if you have obesity or diabetes or some of these other chronic conditions, the risk of a severe illness, of needing hospitalization, is 3- or 4-fold higher with each of those. And so that means in combination, if you have, let's say, diabetes and obesity together, you could have an 8-fold higher risk of being hospitalized. These are massive numbers. And when half of American adults have diabetes or prediabetes, and about 2 in 3 American adults are overweight or obese, this is not small change. I mean, these are big, big, big numbers.
But I'm asking, why doesn't the government say anything? Why doesn't the government say anything? We know what the problem is. But why are people so afraid? Why is this such a third rail? It's a health issue. It wasn't when it was smoking, it wasn't a third rail at a certain point. It was something people were absolutely telling you can't do, and they sued the tobacco industry. Should we have a sugar tax? What should we do on a policy level?
Well, I think, again, in terms of government officials, state and federal officials, they have shown that with simple public health messaging around social distancing, wearing masks, washing hands, people change their behavior. So I agree with you. It's a huge missed opportunity, and it's not too late. We should be telling everyone every day, you're at home. 330 million Americans are having a national experiment to eat at home together and be at home together. We should be active. We should be trying to sleep. We should be eating just even a little bit healthier. And, across the whole population, Bill, small changes in weeks can make a difference. And over a few months, we could, slowly start to improve the health of our population. So I don't know why, I'm not, in those people's minds, but I think that it just maybe doesn't seem that important, or it doesn't seem like it's that big of a deal. But it's a really big deal. I agree with you. And we need more than just messaging, of course. And I think that's what your question, highlights, is how do we get around this? And when you have 2- and 3-year-old kids who are obese now, when you have every segment of the population, every education and income level affected by these diseases, every country in the world affected by these diseases to some extent, we know we have a structural problem. This is a systems problem. This is not about individual behavior or just choice. And so we need systems solutions. And I think there's really 3 top priorities that we can talk about in more detail. Food is medicine, to use healthcare dollars to pay and help incentivize healthier eating. Innovation and entrepreneurship, to push the science to allow innovation and business growth to really tackle what's ahead of us. And federal coordination. We spend over $150 billion in the federal government around food and nutrition programs and other things, and they're uncoordinated, and we need federal coordination. And so I think with food is medicine, science and innovation, and coordination, we could tackle this pretty quickly, actually, within several years.
But that isn't what the medical establishment does. The medical establishment listens to lobbyists. I mean, we get our advice from food from the Cattlemen's Association, from the dairy industry, from Big Pharma, from Archel Daniels Midland. They make corn in great supplies. Then we have to eat it. There's a lot of pressure, not just with politicians, I think, but with people in your profession to go along, to not even say some of the things you're saying now, which are fairly mild. Where do you think that comes from? Is it all just the money? Because I know there's no money in healthy people, and there's no money in dead people. The money is in what America is: chronically ill people who constantly need pharmaceuticals and medical services. Is that not correct?
Well, I think all the money, over $1 trillion is in the healthy people. We're just not valuing it and rewarding it correctly, right? If we, it's shocking, Bill, how healthcare costs have risen, as you alluded to. Healthcare costs from in the last 50 years for the federal government have risen from 5% of the federal budget 50 years ago to 30% almost now. The same thing for states. It's 30% of the average state budget. For U.S. businesses in 1970, they spent a total of $80 billion on healthcare. Adjusted for inflation, they now spend $1.2 trillion on healthcare. That's stagnating wages. It's suffocating every other priority for business, for government. So there's huge savings to be had here. The problem is, I think, twofold. One, this is pretty new science. And so, for most of the last century, we were worried about starvation. We thought we were going to have 1 billion more people on the planet, and we didn't have enough food to feed them. And we were worried about the science of the 1930s, 1940s, 1950s, 1960s, which was vitamin deficiencies, things like scurvy and rickets and pellagra and night blindness, these diseases where if you don't have the right vitamin in your food, you get sick. And so we actually very purposely built up the modern food system, which is a food system that has loads of cheap, shelf-stable, starchy calories that are fortified with vitamins. That was an intentional goal. And it was an intentional goal to address widespread fear of starvation and vitamin deficiency. And what we've learned, and this is new science, this is not something we knew even 30 or 40 years ago, what we've learned really in just the last 20 years especially is that that simplistic approach to vitamin deficiencies and kind of mass starvation, which has been very effective for those conditions, doesn't work for chronic diseases. It doesn't work for obesity, for diabetes, for cardiovascular disease, for cancers, for what we're just starting to learn about the gut microbiome and immunity. And so we have this kind of legacy system that's been built over 100 years, and we built it purposefully. And so that actually gives me hope that we can purposefully now build another system that is good for the population and good for healthcare costs. And millennials are leading the way. So I'm actually quite optimistic because millennials are demanding food that's healthier, that's, sustainable, and that's trustworthy. And businesses are hearing this, and businesses that don't change are not going to be here in 20 or 30 years.
Thank you so much for joining us. I got a pizza coming. I got to, but I appreciate your expertise, and I'll see you soon. Thank you, Doctor.
Of course. Great to talk to you. Yeah.